All right. Okay. So again, welcome to ESF. This is our third official virtual engagement session for really any student, new or returning, as well as any family, advocate, friend of our students as well. So today's session again is on health and wellness at ESF. Again, this is being recorded and we will post the link of the recording that will be closed caption as well tomorrow, and you will get the recording in your Zoom registration link. And I apologize, there is a fly driving me crazy. So today we are going to feature our Counseling Services Director, Ruth Larson, our dear partner at Cross Medical Practice, ESF's Health Center preferred provider, Lori, and then Mary will touch on, Mary Triano, our Senior Assistant Dean, will touch on her role as student support, and then our connection with Syracuse University's Center for Disability Resources. And then Dean Lombard will talk about health insurance and immunizations as well. So I know that there are some more people joining us and we'll catch up as we go. Feel free to use the chat feature throughout and we will monitor that as well. And we will get started. Ruth, take it away.
Hi, everyone. My name is Ruth Larson. I'm the Director of Counseling Services at SUNY ESF. And I just wanted to introduce the rest of our staff with everyone. They are 10-month employees, so they are off for the summer right now. They'll be starting back August 10th. So we have Maggie McCurdy, and Joelle Conan is our newest staff therapist. She'll be joining us in a couple of weeks. We also have an SU practicum student named Tyler Kerr, and Tyler will be working with us for 18 months, and he will be seeing students right alongside of us. And we all have our different specialty areas. And so I just kind of wanted to give you kind of a brief bio of each of us and kind of what issues we tend to deal with. So my specialty areas, well, first of all, I should say that we all specialize in the typical things that college students come to counseling for. So things like depression, anxiety, stress, insomnia, any of homesickness, assertiveness, communication, relationships, all of those things. And then we maybe have some specialty areas. So I tend to work with grief and loss and trauma. Maggie's specialty areas are eating disorders and body image issues. She also works well with students who have neurodiversity. Joelle's specialty areas are on alcohol and drug addiction, use and abuse on college campuses. And Tyler would really like to work with male students and students who are enrolled in the EOP program. Can you advance the slide? So students come to counseling for a variety of reasons, and we want to make sure that students feel comfortable with the services that we provide. We are a relatively short-term solution-focused counseling center, so we are not going to jump in and deal with maybe long-term childhood trauma, complicated grief and loss, any of those kinds of issues, maybe more than what we are able to provide. But we really want to make sure that we provide our students with good quality care. So students come in with interpersonal relationship issues. They may have a roommate for the
Ruth, we may have lost your sound. Ruth, can you hear us?
We're very connected to our Choose Action Network, and we which addresses sexual and relationship violence on campus. And so we believe that counseling can bring better coping skills, higher self-esteem, stress relief. We believe that counseling can provide all of these things to students. So we want to make sure that everyone knows that we keep current on current trend, or keep up to date on current trends and best practices in the field. So everyone who is a student at ESF who pays our student health fee is eligible to receive counseling services. So there's no out-of-pocket cost for our services. Again, we are short-term solution focused. If we think that the student may be better off with a long-term counselor, we will definitely work with the student to make sure that we take care of thinking about health insurance and costs and transportations if they need a provider out in the community. And we have really good working relationships with counselors in our community. So how does a student get into services? So first of all, we are connected right to student affairs. We're literally connected to them in an office suite. So we are in Gray Hall, and our appointments are 8 to 4:30. And appointments are usually 45 to 50 minutes long. And we have after hours, we have our phone line gets rolled over to a crisis call center that knows our students, that works with our students, knows about CEN10, knows about the culture at ESF, and they will make sure that somebody has somebody to talk to at 2 o'clock in the morning or 4 o'clock in the morning. We never want anybody to feel like there's no one to talk to. So we really want to make sure that people know that at any time they can call and talk to a counselor. During work hours, Monday through Friday at 10 a.m. and again at 2 p.m., we have what we call our crisis open hours. So if a student is struggling through the day, they know that at 10 a.m. or 2 p.m. they can land in counseling services and be seen. So we want to make sure that that is out there so that all new students know that that is open and an option for them. So obviously we take confidentiality very important. What is said in counseling stays in counseling with a few very severe exceptions. And if someone is very, very suicidal and we have worked with that student and we have really tried to bring in coping skills and get them connected to loved ones and resources, and we cannot get that person to a point of safety, then we may need to break confidentiality. But please know, the counseling file is never part of an academic record. And so if professors call and says, hey, I know so-and-so is in counseling, we're not giving any information to professors and to parents who call and ask without a signed release of information from the student. So if you decide, or when you decide that you want to come in for counseling, we need to have a conversation with you that's maybe 5 or 10 minutes. And it can be on the phone or in person. In that first contact, we wanted to decide with you if you are coming in for a regular appointment, like we can schedule you in 4 days or so, fine. Or if this is like an urgent appointment, like, ooh, I think this person needs to be seen today, that would kind of go in the urgent category. Or if it's an emergency, like we need to get you in right away, we want to make sure that we have that information. So we're going to ask that first off, and then we're going to ask, like, what kinds of issues are you concerned about? Are you concerned about insomnia? Are you concerned about your physical body? Is it not working well? Are you having some depression symptoms? Are you having some anxiety symptoms? So we want to just ask those questions, because if you say that you have some maybe alcohol use issues, we're going to hook you up with Joelle. If you have some eating disorder, body image issues, we want to maybe hook you up with Maggie. So I just wanted to make sure that you knew that in that first contact, you're going to be asked some questions just so we can match you with the right counselor. Then you will be scheduled with an intake appointment. So again, we try to get those appointments in very quickly. So during an intake appointment, which is again is about 45 or 50 minutes long, you will be asked a bunch of questions from your counselor. So you will have filled out a paperwork packet, which we're going to ask a lot of questions. And then we're going to ask you more questions. There's going to be questions about safety, obviously, about family history and your academic history and your health history and those kinds of questions. So we want to kind of get maybe what we would call like a bird's eye view of what's going on in your life. We always want to make sure that you leave that first session with some tools, some skills in your toolbox. And then we'll talk about whether you want to make a second appointment or not. During any of your sessions with your counselor, we want to make sure that you use your time as well as you can. So you may be given homework assignments because that happens in counseling. So we want to make sure that you come in with things that you want to talk about. We are going to be talking about strategies. One of the things that we always want to keep in mind is that, we may give 10 suggestions and 7 of them might work, and the 8th one might kind of work a little bit, and 9 and 10 are like, no, those aren't going to work for me. And we kind of know that going in, that we want to offer suggestions and find which ones work best for you. Laura, can you progress things? So one of the things that's really important that we want to teach our students to do is to cancel appointments. So every year we do have too many what we call late cancellations or no-shows. And that means that an appointment time was set for a person and that person didn't cancel in enough time that we were able to give that appointment to someone else who needed it. So it's going to be really important for our students to know that holding that appointment time for them comes with some responsibility. And if they need to cancel, that they give us a call and let us know, or email us and let us know. Sometimes counselors and clients don't have the best fit, and we don't take that personally. I know that I'm a good counselor and we have good counselors on our staff, but we know that we may not be the best counselor for every single person. And so if you feel like maybe you don't match with your counselor, you can let us know. We are not going to be hurt by that. We don't take that personally. We want to just make sure that you're matched up with the right person. Because if you feel like you have a connection and a fit, you're going to come, you're going to get better. And, that's what we want. So if you don't feel comfortable talking with your counselor about that, you can talk to the person at the front desk and they can make that switch. So really, that's totally okay to switch counselors. I mentioned this before, but sometimes a student might need more intense counseling than what we're able to provide. And so we want to make sure that that person is handed off to a counselor out in the community. And so we're going to work really hard in finding a counselor that you fit with, that your health insurance works with, that you have the ability to pay co-pays. We want to make sure that all of that stuff is taken care of. And then you can continue seeing the ESF counselor until you have met with that next counselor. And signing a release of information is really a good idea so that we can send along our information so it doesn't feel like maybe you're starting from scratch. So we will check in with you after the referral just to make sure that it's a good fit, or if something has happened, come back to us, let us know when we reach out to you, and we'll try to make sure that your needs are taken care of. So I wanted to point out on this slide, on our website, we have a student resources page, and on that it is chock full of information for our students. So on that student resources page, we have videos on important topics like anatomy of an all-nighter. One of the things that we always see in students is that they tend to start skipping sleep very early, and it really affects them, unfortunately. So we have a video on there called Anatomy of an All-Nighter, that if they have to do an all-nighter, here's some better ways to maybe make that work. We also have like a video on stumpy self-care. So check that out and see. The other part on that student resources page is a bunch of quizzes or self-assessments. So if a student is wondering like, do I have ADHD? They can take this quiz, you know, anonymously online and, you know, get some information. Like, I do have a few of these symptoms, or, you know, am I sad, or is this depression? So we just want to make sure that students know that. The other things on our website are frequently asked questions. So any questions that you have about counseling services, we try to put in there so you can get at your leisure. And then counseling procedures, I kind of try to break down like what to expect for a first session and subsequent sessions and all of these kinds of things. So we just kind of wanted to make sure that we line those things out for you. So again, counseling services, you know, looks forward to seeing you all back on campus. And if you have any questions, please let us know.
Hello, everyone. I'm going to talk a little bit about health-related information, and I'm going to start with a question that everyone has on their mind, which is COVID vaccination information. So new students, well, let me back up and say, so far, vaccination is not required in the state of New York for SUNY and CUNY students, but it will be required once the vaccine has been approved by the FDA. However, Syracuse University has required all their students to get vaccinated. And for our students, because of our unique relationship with Syracuse, you will need to be vaccinated to use the facilities there, which includes all of the dining services, libraries, classrooms, some labs if you're taking classes over there, recreational facilities, and others. So new students received an email from me requesting vaccination information. You'll receive subsequent emails, so we'll continue to ask for that. This was sent on June the 25th and should be sent here again toward the end of this week. In that email, there's a link to get into a survey to upload your vaccination information. Also in that email is instructions to request an exemption if you have medical reasons or if you have sincerely held religious beliefs that prevent you from being vaccinated. So we really strongly encourage everyone to get vaccinated. SUNY is expecting that those students who are not vaccinated for whatever reason will continue to be masked, will continue to social distance themselves, and will continue to get diagnostic testing on a weekly basis. So we're really hoping that the vast majority of our students come to campus vaccinated. And if you have specific questions related to COVID vaccinations, happy to answer them in the chat, or you can reach out to me individually. Laura, next slide. Okay, there is life beyond COVID though, as I joke with our staff. So a couple of other health related things that I want to mention to you. One is about health insurance and the other is about regular immunizations. So all full-time students, undergraduate and graduate students, are required to have health insurance coverage. This is something that you need to manage each year. So all full-time students will see a charge on their bill for the ESF student health insurance plan. For many of you, it probably was on your July 15th bill, but don't worry if it wasn't, there's still plenty of time. I think the charge is $2,430 this year. But we recognize that most of our students have health insurance through some other means. So generally for our first year students, through your parents or your guardians, sometimes through your employment, through your spouse, for other reasons. If you're a veteran, there are many reasons that you might have your own health insurance. So We don't want you to stay on the ESF student health insurance plan if you don't need it. And we certainly don't want you to pay for it if you don't need it. So you can sit down at the My ESF portal and easily waive out of the health insurance. You need to have your health insurance card in front of you to do that, because you need to enter in some information about your coverage. But again, this is something that you'll need to do every year. The deadline every year to waive out of the ESF student health insurance plan is September 30th. And be sure, and that last bullet is a really important one, be sure to check with your health insurance carrier if you've got your own, to make sure that you are covered in and around Syracuse for hospital and medical needs. So that's what our intention is in requiring students to have health insurance coverage and to provide that information to the college. The other thing I'd say about health insurance is that occasionally students will find after they've waived out that they need to be in the plan after all. That's an easy thing to do. Sometimes students will age out of their parents or guardians' health insurance. They've reached that magic age of 26, whatever the reason might be. You can buy into the ESF student health insurance plan at any point in the school year, and it is prorated based on when you buy in. So important reminder, this is something you do every year. We don't want you to keep it if you don't need it. It's easy to waive out. And I understand that there's been some difficulty on the portal with people not finding this. It's under action items, but it's also possible we've had some difficulty as we've transitioned to our new student information system, that there have been periods of time where it's not showing on the banner portal. So don't worry, you don't need to waive out until September 30th. The other thing I'd say before I move on to immunizations is, if you know that you want the ESF student health insurance plan, you can also go onto the portal and enroll before the September 30th deadline. So if you know you want it, go onto the portal, enroll proactively. That will help ensure that you get your insurance card sent to you quickly. That's emailed to you. But again, after September 30th, if you haven't waived out, you're on the hook for that very big charge, which we don't want you to pay unless you need it. So that's health insurance. Then I want to talk about regular immunizations. So per New York State public health law, you have certain immunizations that are required for you to go to college and also K-12. So you need measles, mumps, and rubella. You need to submit this information to us via the ESF immunization history form. You can see the link to that. The deadline to submit this information is September the 25th. And this is something that you only do once. So once you submit that information to us for this year, you're good to go for as long as you're at ESF. This is submitted via the My ESF student portal, but it's evaluated by our good partners at Crouse Medical Practice, and they do the verification of that. So you can see on the slide, those of us in student affairs don't have access to those submissions, and we can't confirm that they've been received or that they've been approved. But please know that right now, no news is good news, because Crouse Medical Practice will begin reviewing those submissions next week. So some of you have probably already uploaded that information. So you're required to get measles, mumps, and rubella, which most of you probably have already done. We just need documentation to support that. There's also a second part to that that requires that you either share with us when you got your meningitis vaccination, or you have to check some information that you're aware of the risks related to meningitis. So, and then the last thing that I would mention to you is that we do not have a pharmacy on our campus. We don't have a student health service on our campus. Lori's going to talk here in just a minute about Crouse Medical Practice, but we do have a relationship with Kinney Drugs, by which they will deliver prescriptions to campus every business day if they're in by a certain hour. More information about that can be found on our health website, esf.edu/health. So any questions that you might have, happy to monitor the chat, or as I said, feel free to reach out to me personally, and I'm happy to help. Thanks, Laura.
Everyone, I just wanted to, as Lori comes on from Cross Medical Practice, we'll also take questions at the end. We just have a couple more presenters, and I apologize, the PowerPoint keeps getting stuck, so I'm sorry it is jumping around a little bit. Lori, if you want to join us and unmute, you are up next.
Hi, can you hear me? Okay, so hello everyone. First off, I want to start by apologizing that I'm not on video. I had a slight little family emergency, so sitting actually in my car, but I wanted to join all of you tonight and provide you with this information. So we are very proud from Cross Medical Practice to be partnering with ESF. We've been doing this, I believe, and correct me if I'm wrong, I believe we're entering our 6th year of providing student health services for the SUNY ESF student population. And we're just very proud to be a part of this and to be able to provide these services. So we are actually located right on Irving Avenue, down the hill from SUNY ESF, and we're located directly across the street from Crouse Hospital's emergency department. So that picture that you see in the bottom left corner is the front of our building, and you will find us inside that building in suite 300. So it is the SUNY ESF Student Health Center is open Monday through Friday from 8 a.m. until 5 p.m. We do ask that you call ahead, especially in light of the situation with COVID, because we want to make sure that we're keeping healthy people separated from people who are sick. The SUNY ESF Student Health Center does have its own suite, and that what you're looking at on there is the entry desk for the reception area where one of our SUNY ESF Student Health Center employees will greet you. So it is typically staffed by Mackenzie Rotella, who is a nurse practitioner, and she has been with us the entire time that we have been partnering with ESF. She does a fantastic job, and she has built great relationships with the students, very trusting, very knowledgeable. She is helped by Debbie Barrage, who is an LPN, and by Cindy Crooks, who is our medical secretary. So there are 3 exam rooms in the SUNY ESF Student Health Center, and everything that is done there is very professionally done, very privately taken care of. Debbie, Mackenzie, and Cindy are always available to answer any questions that you might have Monday through Friday between 8 and 5. If you happen to call after hours, you can leave a message and they will get back to you first thing the next morning on the business day. So the phone number to the SUNY ESF Student Health Center is 315-766-1628, and that is something that you can leave a voicemail on, and that voicemail is checked regularly throughout the business day and is also checked first thing every morning throughout the business week. So typically you're going to be able to get right through to us. So you're not going to leave a message Monday through Friday, 8 to 5, but in the event people were away from their desk, then yes, you would leave a message. So I did see in the chat some questions regarding lab capability. Yes, we do have lab and x-ray on site. So if you were to have labs drawn, the lab is located in suite 350 in the same building, just down the hallway from the Student Health Center. We also have x-ray capability on site in our building. We are affiliated with Crouse Hospital and Crouse Radiology, so they do provide our x-ray, our imaging. They are able to also do CAT scans, and we can set folks up for MRIs if needed. So we work very closely with Crouse Hospital for those services. Cross Medical Practice is a multidisciplinary practice, which means we have all different types of specialists. So if you were a student who needed to see a cardiologist or see a surgeon or see a neurology doctor, we have the capability to refer right within Cross Medical Practice. So many of those providers are actually located in the same building. As a matter of fact, all of them are located in the same building. So those types of services are available to the students as well. For after hours, we do recommend if you had an urgent matter that could not wait till the next business day, that we do recommend either the Crouse Emergency Department or one of the local urgent cares in the community. And I will also share if you had some sort of orthopedic injury, bone injury, and it's evening hours or on the weekends, SOS, Syracuse Orthopedic Specialist, does have their own after hours clinic that is staffed by the orthopedic staff from SOS. So you're not with folks who are having sore throats and that type of stuff. It is all orthopedics, and they have a location over on Wide Waters Parkway over in East Syracuse. We have, if you come into the building, as I said, it's best if you call ahead so that we can make appointments for you. You will be screened at the door. It's a requirement by the Department of Health that we do screen all patients and visitors coming into the building. So you would have your temperature taken and a couple of questions asked of you as to whether you're feeling sick or have recently been exposed to COVID, those types of things. And then you'll be asked to wear one of our masks in the building. And that again is a requirement from the Department of Health. Regarding any other services that we can provide, we are able to refer to, let's say you needed to see a gastroenterologist. We have great relationships with all of those types of providers in the community, allergists. We have pulmonology, we have endocrinology. So if there's somebody with diabetes or those types of things, we have the ability to refer to them as well. So again, it's a great relationship to have with SUNY ESF. We have enjoyed this and we feel very strongly about the care that we can provide to the students. One thing I know that was brought up just a little while ago was the release of information form. So as the students are adults, their health information is protected. So we oftentimes will have parents calling in wanting to, know maybe, have some information regarding their daughter's visit the day before or something like that. So we do have to follow all of the privacy laws. And so in order for us to share information, we do have to have a written release of information form from the student to do that. So I know as a parent, that was a struggle for me because I'm like, well, I pay the insurance, I've taken care of her whole life, but they do reach this age where it is their responsibility to sign, your responsibility to sign that release of information form. So I see something about being closed on us being closed on. So in those types of situations, again, we recommend if it's an urgent matter that cannot wait for the next day, that you be seen in the Crouse Emergency Department or one of the local urgent cares. And we all communicate with each other, so we are able to receive those records and do any follow-up care that is necessary. Not sure if there's any other questions. In light of COVID, we do COVID testing. So in the event that we would need, if a person is symptomatic, we are able to do COVID testing down at our site. If it's more of a test for, you just need to check this because you're traveling or something and it's required, we do offer that at one of our other sites in East Syracuse.
Thank you so much, Lori. We'll keep monitoring the
You're welcome.
have Mary Triano last, and then we can go and just recap some questions too, because we have plenty of time.
Perfect.
Thank you so much.
Perfect. Thank you.
Mary Triano, next up.
So I thought I would just kind of recap a little bit of what one of our good partners who joined us a few weeks ago talked a little bit about when they were visiting with us and talking about the Center for Disability Resources. So the Center for Disability Resources is an office located at Syracuse University. It's one of the services that we receive as part of our very unique relationship with SU. You will often hear me describe the Center for Disability Resources as ours, because that's truly how I believe that they function. That's how they believe that they function, that our students are served just as well. There's no difference in the service and the care that students at ESF receive when they go to and work with the access counselors at the Center for Disability Resources. So you'll hear me refer to them as CDR as their acronym. If anyone is in need of any academic accommodations, particularly academic accommodations, this would be where we would direct you to register with their office and kind of begin a relationship with one of the access counselors. This is where you would send any IEPs and 504 plans that might have been in existence in high school, or if there was something in the, that you might have an IEP that you might feel is outdated, I would still send it, because they're going to look at all the documentation that you have, and they're going to talk directly with the student to just understand what it is that they need to be successful in the classroom. So once they identify an accommodation plan, an access plan as they call them, they will be in touch with the faculty that your students may have in class to share here the accommodations that are in place. Faculty, if they have any questions, will be able to outreach to the access counselor, talk through how to implement. Many times, some of the accommodations are one-on-one conversations between the student and the instructor, just to make sure everything is moving and in place appropriately, and everybody feels good kind of about the pace in which you're moving. So that would be another place to kind of think about if that's something that you need. If you have any questions more specifically, I would definitely encourage you to reach out to CDR directly. I can answer some superficial questions. I'm not an access counselor, so I wouldn't be able to tell you what accommodations are available. And I would also kind of encourage anyone, this will happen through the duration of some students' experience, where they may need temporary accommodations. I've had students who play intramurals or athletics in college, and they may sustain a concussion, and they may need some temporary assistance. And that is absolutely something that the Center for Disability Resources can also assist with. That it doesn't have to be any kind of chronic condition or disability. Students who have, they may break their dominant hand and might not be able to type or write the way that they are normally able to for a series of weeks. So those would be the things that we would definitely want to encourage you to think about. And if you have questions for them, they're very, very good about helping you navigate what might be the most helpful for you and your student. So that's just a very short overview from CDR that I wanted to kind of offer to you. You can kind of go forward from there, Laura. And so I wanted to just spend a very, very short window of time kind of talking about what my role is as the Senior Assistant Dean in the Office of the Dean for Student Affairs. My work is primarily directed to providing student support and assistance. And I always kind of try to tell students that they don't need to kind of know what exactly it is. A lot of times the walk-in traffic into my office, students aren't exactly sure that they're supposed to be there. And so if there's a question or they're confused or they're not quite sure how to navigate something, my office is a really safe space in which they can come in and kind of ask those questions. I have a lot of times students aren't really sure what the problem is, but they can kind of describe for me what it is that they're experiencing. And we'll sit down together and we'll talk about resources, options available to them at the college, who the people that they may need to be talking to, and maybe how to go about approaching those conversations. So those are some of the pieces of, why a student may find themselves in my office. The reason varies from person to person. There doesn't have to be a crisis to come in to speak with me. It could just be something that they're struggling with in the moment. So even though I do usually assist with any student or their family who may be experiencing a crisis, I would be a point of contact, as well as Dean Lombard as well. The two of us work kind of in concert together to make sure our students have the support and the resources that they need. I included a couple of things just to kind of tag into some of the other things that might kind of might come up in your students' experience while they're at ESF, that you can think about maybe reaching out to me if you have questions about. Sometimes students need to take a semester off. Sometimes they need to take a year off. Sometimes they need to be away for surgery or a family emergency, and they need potential assistance in kind of connecting with faculty. Students may have a difficult time kind of talking with their faculty and not quite sure how much to disclose about what's going on in their lives. And so I would be a person that can kind of help coach them through those conversations. So, I always kind of say, when in doubt, drop me an email, walk into the office. We can find 15 minutes to sit down together. That's something that happens on a regular basis in my office. It's, I can usually get people in same day. But if I can't, I'm going to work in advance with a student to make sure that I get them in as quickly as possible. So that's just a little bit about my role at the college. So like I said, when in doubt, you're not quite sure where to go, I'm a great place to start.
Thank you so much. That was another accident. All right, I am not going to share my screen because we're having some little technical difficulties. We have everyone again on this Zoom. So to recap, we started with Ruth Larson, Counseling Services. Then we went to Dean Lombard to talk about health and wellness, health and immunizations, as well as Lori from Krause Medical Practice. And I know, I believe she is here. And Kim Max also joined us from Centennial Hall, who you officially met last week. And we have Mary Triano again. So I just want to go through the questions just to make sure anything was left out. If we did leave your question out, please just put it back in the chat, or you are very welcome to unmute and ask the question out loud as well. I know that there are some immunization questions. So the immunization history form is right on the esf.edu health page, and you would download that and get the immunization record there, and then you would upload it to the My ESF portal, which students use their ESF ID credentials to get in. Some students did not do the Duo security system, and that happened just a couple weeks ago, so they are not able to get in. It is not a password issue, it is a security issue, so it takes probably 30 seconds to do that, and then they're good to go. So that might be a problem if students are experiencing any issues with their ESF credentials. And then they would go into the action item step and upload their immunization records. And then our friends at Krause Medical Practice will review that starting next week and let you know if there's any error or missing immunization. And we'll be in touch with you all on that. Kim Max also has noted that move-in information was sent out late this afternoon. So make sure that your students check the email they used to submit their housing application, which may have been a personal email, probably for sure. They probably weren't using their SYR or ESF email at that point. So just have them check their email, check their spam folder. You never know where it might go. Even some of us are getting emails from students in our spam, but we generally check those pretty regularly and save the email, and that shouldn't be a problem moving forward. I know there was a question about student athletes. So student athletes, you will get further information from the athletic team. Krause, I saw some questions about psychiatric branches, and Ruth Larson had answered that question about, scrolling through here, St. Joseph CPEP and Upstate University. Are there other questions that I'm missing, or if anyone has anything more from our panel to add that maybe I didn't mention out loud? And I will put the Duo link in because, again, I've shared that with several families over the last couple of weeks too, just so you have that. And we do have a nice directory on our website of offices. So if you go right to the main ESF website, esf.edu, there is an A to Z directory of offices, and that's often where I start. We obviously have a search engine as well too. Are there questions from anyone?
Hi, do you hear me? Hi, I'm Hannah, and I'm wondering about this immunization records. So does it mean I'm downloading some kind of form that needs to be given to the doctor of my child, or I'm filling it out according to the immunization record I got? you know, like the piece of like a card I'm getting when the child is born, and the doctor fills it in. So how who has to fill it out?
You can, well, I can let Lori answer that question.
So I think probably the easiest thing would, you could either make a copy of that card and attach it to the documents that you get as far as the immunization forms, and we'll enter the information for you, or you can fill in the information. But I think it's probably easier if you just make a copy of it and attach it to the forms.
Oh, okay. Okay, thank you.
You're welcome.
Thank you for the question as well. Are there other questions? Again, feel free to unmute and ask that as well. I did also just post the direct link to the PDF of the immunization form, so you don't have to click a couple of times onto the website, but a lot of our websites are esf.edu/health or meal plan. So some sites are pretty easy to remember and others are a little bit longer. So I will also post the link to the Information Central page that has the e-newsletters that I had mentioned to a family in the chat, as well as the Zoom sessions that we have. And this is again the third one. We have one more next week, which I put in the chat, but it is on fall 2021 programming. So you'll meet the office sort of responsible for a lot of the key programming that happens at ESF, and then we'll go over some of their fall programming plans so you get a sense of what else is going on. We don't have a great way to collect all family emails at ESF, so we try our best to update families with the emails we have, and those generally start actually from Centennial Hall. We have been pitching family weekend, so many of you may have received a little save the date card of our family weekend schedule. So we try and communicate, but we don't do a ton of family communication, but we certainly try and keep these sessions going and some timely information. And if there's anything major, it is even posted typically on our homepage or somewhere where students know about it. In terms of My Slice, if My Slice isn't working for you specifically, I would email SU. I know some families have been having some meal plan specific issues within My Slice, and they may not have been into the SU meal plan and housing system. And so I'm happy to direct the question and the student name to the housing office, and they are able to add you in for that specific feature within My Slice. If you're not able to get into it at all, it could just be an SU NUT ID and access issue, and I'm happy to troubleshoot that with you. SU does also have an ITS help number and answer that I believe very promptly, so I'll put that number in the chat as well. Family weekend is going to be Saturday, October 2nd and Sunday, October 3rd. We end with a lovely pancake breakfast with ESF homemade syrup in our property in Hyberg Forest, which is located in Tully, New York, about 30 minutes 25-30 minutes south of Syracuse. It's a very lovely property. Family weekend itself, the bulk of our programming is all day Saturday, from tours and specialty tours, campus tours, and then we do some traditional events, tie-dyeing our family weekend shirts if you're welcome to do that, or get a solid shirt. You don't need to tie-dye, of course. We have Birds of Prey. We're doing a little bus trip to our local apple orchard nearby, and we're working on some more programming, but we have a tentative schedule online, and I'll post the link there. Are there other questions? Yep, for Family Weekend, the events and activities are for all students and families. And we try and have a variety of programming for really all ages, kids through grandparents, et cetera. So certainly there's not, I don't think anything that anyone can't participate in. We did have a little taste of Central New York, which had some alcohol tastings that obviously was not kid friendly, but we're doing something a little bit different there as well. I'm just going to have our panelists give one quick piece of advice. If you want to unmute, and we'll start with the order of presenters. One quick bit of advice for the students in the audience and our families.
Okay, from counseling services, I would say just encourage your student to sleep, because seriously, the lack of sleep is one of the things that we hear the most from students, from faculty, from families. And so without sleep, learning isn't possible, and you know, all their studying is going to be for naught. So really encourage them to get their sleep.
Great advice, Ruth, and sleep is important for all ages, for sure. Dean Lombard, did you want to share some advice as well?
Absolutely. Probably the best advice that I can offer to students is to remember that you are your own best advocate. So we can't always know when you need help. There are lots of resources and people we would like to connect you with when we learn that you need help, but you need to reach out and let us know sometimes. So advocate for yourself. Don't be afraid to reach out to people in offices around campus. We're here to be of assistance to you.
Thank you so much. And Lori, and then Mary and Kim.
Hi, everyone, it's Lori. So what I would recommend is that you do everything you can to stay healthy, stay hydrated, and get your rest, and know that we are always there for you, that you can call us. We are, if you just need someone to talk to through a situation, but we are here to support you, and we want you to make the best of your college experience.
I think what I would offer as advice is, you know, to ask questions and be intellectually curious. I know that was talked a little bit about a few weeks ago, but Dean Lombard talked about being a good self-advocate. And I think it's, you know, what I would say is spend the time with your instructors, with your faculty. The number one question that comes into my office all the time is kind of how to have those conversations with faculty, feeling intimidated and like they're not going to be willing to help. And what I would absolutely want to just kind of affirm is that our faculty are wanting those office hours to be used. They are excited to develop those relationships with students. Students often feel overwhelmed and are afraid to potentially ask those instructors for a little bit of assistance. And as long as they know what the struggle is, they're very willing to help. So ask the questions, ask for assistance. There'll be lots of responses to try to be supportive.
I guess it's my turn, I guess. So from my perspective, I would say be social, know that you're here for a reason. Students, they were accepted because they can succeed here. And no matter what is going on, there's always somebody here to help. You just got to ask. You know, we're not mind readers. And so if we don't know what's going on, we can't help you. But we're not going to solve all the problems for you. We're going to, you know, we're going to help you solve the problem. We're not going to solve it for you, but we're always going to help you to find the right solution for you. My other piece of advice, and if you were on the call last week, is read your email, please. That's it.
Thank you so much, everyone, for those tidbits. And I like that they all had a little bit different messaging. I will also say that encouraging you as a student or your student, if you are a family member of a student, to try something new and get a little outside of their comfort zone. It could be that one club or that one conversation with a faculty member. And we try and facilitate a lot of that, from our activities fairs to some of the speakers our student organizations bring into an event that I love called Field Days. You just never know what that one conversation could lead to research, to TAing a course, to starting your own club or organization, to going to grad school or getting a PhD. And I've been here over 10 years now, and seeing some of our former students go on and do these amazing things, from really cool educational, the sky's the limit with ESF. And so really just encouraging your student to just try something that they wouldn't have tried before. And with the pandemic, putting that kind of life on hold a little bit over the last 18 months, I think now is the time for them to, once they're comfortable settling in, to just try something new. And it doesn't have to be a safety thing. It could just be, I had a conversation with a faculty member, we were safe wearing masks or whatever, and they asked me to do this or that. So that's what's really unique and special. And what I think we've all missed is that human connection face to face. So excited to have you here. And just as a reminder, we have one final session next week, again on that fall 2021 programming plans. I'm recording this, but in the email, you'll get the final recording, Zoom registration link as well. And I want to thank again our panelists for joining us and talking about health and wellness today. I think it's a really important topic. And so if you can encourage your student to just navigate this as well, it is in their Blackboard course, which they can get into with the same SU credentials as the MySlice portal and their SU email portal. And as Kim mentioned, we do want them to read their email, because that is the best source for us to share everything. They do get a lot, and carving out that email time so that they're not logging in once a week and being overwhelmed with a ton of emails, even a few times a day, would be recommended, so that it's manageable and they're not information overload. So it is 8 o'clock. I appreciate you all being here, and we hope to see you next week. And let us know if you have any questions. We shared all of our contact info in the chat and all of our ways to contact us. So thank you again, everyone, and I hope you have a really great night.